Can you tell me
So,
about that?
well, I got into grief when working with trauma and working with police officers. Started doing a lot of work with the families of police officers killed in the line of duty,
Hmm.
and still do.
Yeah.
So, and then of course in learning EMDR, and also done some very close collaboration on grief with Teresa Rando. Written some articles on utilization of EMDR with grief and mourning.
Okay.
And so she provides a framework on the processes that are important for the assimilation and accommodation of the loss.
Hmm.
So we have grief, which is the acute reaction to the loss. This would be like acute trauma.
Mm-hmm.
And then mourning, which is the assimilation and accommodation to the loss, where we have to recognize the loss, we have to react to the loss. Okay, the
So it's not just the grief that happened. This person passed away. It's not. It's you're saying it's more than just about that.
Absolutely, because reacting, we have to be able to remember our loved one, and because especially traumatic loss can disrupt our sense of world, we lose our world. So we have to change the adaptive world. We have to be able to shift from the world where our loved one was in to a world where now they're not there anymore. So who am I?
Yeah. Can you tell me how you integrate EMDR and how you process grief with EMDR?
Well, first of all, we have to revise our assumptive world, and then we can start to reinvest. Okay, so where EMDR fits in is a number of places. First of all, the trauma of the loss. Okay, we can go in with EMDR therapy on, for example, the moments of realization, like the ground zero when it hit.
Okay. Like when they got the news.
When they got the news, for example. Okay. And then present triggers. How is the person adapting to the loss? So this is also something else to take a look at. There's a loss orientation a person has to go through and a restoration orientation. How is the person dealing with the emotional aspect of the loss? How are they dealing with the adaptation? So we have to provide psychotherapy, guidance, teaching, and EMDR therapy fits into process present triggers, of course, future templates, resource installation. But there's more than that. So there's certainly Terry Rando's, because of those R processes, the processes needed for assimilation and accommodation of the loss. It's important to understand. But what this framework doesn't elaborate on is why people might get stuck in the assimilation accommodation. And here's where we have to understand, again, attachment.
Okay.
So here's where it ties in, is that, as I was saying before, in early childhood, we form an inner working model. And the child doesn't need the parent their whole life, of course. So the child internalizes the working model and has a sense of felt safety from the internalized model. So now the child can go to school and still feel secure and
Secure
play.
attachment, yeah.
Okay, because there's that internalized model. And then there's working models for the people that we love. And when a person dies, we're losing part of our world, our model of the world.
Yeah.
And this can start to trigger the attachment difficulties from childhood.
Yeah.
Because, again, attachment has to do with safety. And when a person dies, we're losing someone we love. We can be losing a sense of our security.
Like the world is not safe anymore.
The world's not safe. And a lot of so the mourning and the grieving reactions that we have can be likened to the lack of safety and distress the young child experiences. And so if there's a secure attachment, with time a person works through the loss. But if there's anxious, insecure attachment styles, or avoidant, or disorganized, a loss can start to trigger the other attachment difficulties.
And this is where they get stuck.
And who walks into our office? Okay, so the practitioner, I ask you who's watching this tape, how many people walk in with something simple? And when somebody comes in with a loss, how often is it something simple?
Right.
People come in with complexity. Okay, people come in not only with a sudden loss, but also there can be the attachment distress or trauma that it also triggers.
So where would you start with a client, let's say, has that, an insecure attachment with a loved one that has now passed away? Would you start with the current grief and then like finding out about the news, or would you go back to the childhood stuff first?
Well, usually we're first starting with the trauma. And that might be when the person learned the news. Or maybe moment of realization is better. Because the moment of realization could have been a month before the person died. I went to the hospital, I looked at him, and I knew we were going to lose him. It may have been a month later.
Okay,
when they, when somebody I worked with went to the police impound lot, saw the car that her husband was in, and goes, oh my God, nobody could have ever survived that. He's really dead.
Yeah.
So that would be the moment of realization.
Okay.
So we'd start there to deal with the trauma. And then the outcome I go for is to be able for the person to start having memories. Now, we can look at the trauma as interfering with the person's ability to have access to the memory network of positive memories.
Okay.
Because they start to think of the loved one, and it's just the trauma, the loss, and they're not there. There's not a sense of connecting. We do EMDR therapy, and now what happens is we can process the trauma, and now they can start to connect to the memories. The memory network, they have positive, heartfelt memories they really feel. So what's happening here is the development of an adaptive inner model of the loved one. So remember I said how the young child starts to have inner working models of safety. Then as adults, there's an interdependency of safety among adults. But the loved one dies. There's that person who I loved, I felt safety with, had companionship with, and they're gone. And so there's that same distress that may have been there in childhood, the same attachment difficulties. Again, what I look for in EMDR therapy is getting access to the memory so they can start to again feel the connection and start forming that adaptive inner working model of the loved one.
And I think that's
But one more thing, that's very important here, because in answering your question, what about somebody with an insecure attachment style?
Right.
So first, let's see if we can work with the trauma of the loss and start getting access to the memory network. But then we also have to work with what prevents the person going through assimilation and accommodation to the loss, and that will be some of these attachment difficulties, and again, finding these seemingly small memories that have to do with the attachment relationship and processing those.
Right, that the person might not be aware of.
That's correct.
Yeah.
The person may not be aware of them, may not be able to connect the dots.
Okay. Well, and something I was going to say earlier is when you're talking about doing the grief work in the EMDR is building in the positive, the connection with the person, that some people might not see that when you think of doing EMDR, just to kind of release these overwhelming feelings, but really you are adding in that positive piece of it as well, like getting closer to the person, feeling those positive memory networks. And I think that was nice the way that you said that.
Well, actually, that's what happens with EMDR. So when I started doing EMDR with loss and traumatic loss, I started noticing consistently that other memories emerged. Other memories emerged. This is what was happening consistently.
Yeah.
So when I started to read the literature, started reading about continuing bonds and the adaptive inner model of the loved one, Fairbairn's, the 50s, some of the psychodynamic, psychoanalytic literature is talking about inner representations of loved ones. Then a way to understand what's happening with the emergence of memories when we do EMDR is that adaptive inner representation. Memories of the person that are heartfelt. This is what lets us know that we loved and we were loved. And it's the memories that help us bridge the past to the present and to the future.
Yeah.
And the heartfelt memories can continue to be a comfort and provide an inner sense of safety in our adaptive inner working model as we go on through life. And so, to me, I call it good grief. Good grief is being able to think of the loved one and have the memories that are heartfelt. And interestingly, I found that happened when I was working with somebody, even within the first month or two, processing some of the awful moments or awful images. They were finally able to get access to the loved one. The pictures. One of the first and meaningful experiences I had was in Oklahoma City following the bombing.
Oh, yeah.
And one of the mothers had lost her infant who had been in the daycare center. And she never saw the body, but it was just told that the baby died of a head wound, and they were being kind. But all she had in her head was what her baby must have looked like with a head wound. So she couldn't access any other memories. The only way to think of her baby, what she looked like, was to look at a picture. So I saw her 2 months following the bombing, and we processed this awful images. And just after the first set, other memories started to come on up. She got access to her memory network. And she also started reliving the day. And she was having memories with her with the baby, dad with the baby, and then reliving the day. And she got to the point where she had brought her baby to the daycare center and kissed her goodbye. And at that point, wanted to stop because she had such a sense of peace. Okay. Now, that was after 2 months.
Yeah.
We're not done with processing because I was working with her again 2 months later at the rage she felt toward the perpetrator of the bombing. So EMDR therapy, let me just say, we're not going to shortcut any of the phases of mourning.
Yeah.
We enable it. We process the trauma that can complicate the grief and mourning. That's what we're doing. We're enabling the mourning because we're processing the obstacles.
That's nice. And how soon would you start doing EMDR with someone after?
Well, the soonest would be the same with any other incident. I think it's not a matter of time. It's a matter of criteria. So, one, the person is maybe out of the numbness, and they're starting to experience the emotional impact.
Okay.
That could be the next day. It could be 2 months or 6 months. Okay? And they're able to stay present with that. That's very important. That's one of the basic criteria for EMDR therapy. And they're able to reflect and not be about what's happening, not be overwhelmed by it.
Yeah.
So there's the criteria.
Okay.
Certainly, when I think back now, I've worked with a number of people where we started after 2 weeks. But there can be some people that's way too soon.
So you have to figure out with your client if they're ready.
That's right. That's right, because everybody's different.
Yeah.
Everybody has a history, too. So it's very important to be able to do an assessment.
Okay.
At the same point, Francine Shapiro makes the point how long does a person have to suffer? So she would ask the question, in the training, that suppose a mother came in and said, 2 months ago my baby died, and I can't eat, I can't sleep. Will you help me? How many of you would do EMDR therapy then? Number some people, yeah, other people no. Well, why not? It's too soon. And then the rest of the story is, well, suppose the baby was sick and she called the doctor, and the doctor said, your baby's fine, don't worry. Baby gets worse, she calls again, oh, don't worry. But in the morning, the baby's dead. How long do you ask the mother to sit with that? So again, we can understand EMDR therapy is being able to go in to these terrible moments and process those to enable a person to start going through the mourning process when they're blocked. So that's why, what's the meaning of time? It depends on, so we have to take a look at the whole person, and do they meet the criteria? Are they, can they stay present with the emotional impact? They're experiencing it. They can reflect, tell you what's happening with it.
Okay. And I've also heard you say that you're not going to take away the natural grieving process.
That's right. EMDR therapy is not going to take away anything a person needs.
Yeah.
I meet a lot of people that are afraid to give up the pain. They connect through pain and not through love. And if I lose my pain, then I'm going to lose my connection. And this is where it's important to explain that EMDR is not going to take away anything that you need. That, and then I explain that EMDR therapy will take away the distress, but it will, because it's going to enable you to process the traumatic aspects and give you access to the memory networks. I also, have some wonderful clients that have given me permission to show videotapes of their session that really illustrate, this dynamic. How it can be so difficult to give up the pain because then I'll lose the connection. And EMDR therapy helps them regain a felt sense of connection with their loved one.
And I heard you say that you're doing a grief workshop now.
Yes, I've been doing grief workshops for a number of years now.
Okay. So are you offering those anytime soon in the States?
I believe I have one coming up in September.
Oh, okay, nice.
In Minnesota.
Minnesota, okay.
But who knows when we're coming back to Texas.
You might be coming soon to do that one. I have a lot of people that I know are interested in how to integrate EMDR with grief. So, okay, thank you.
All right.